Is in the building. One of our favorites has landed this morning, and his name is Dr. Muriva.
Get up and do something. The Ignition. Red hot breakfast for the movers and shakers. Now, let's get moving. Let's get shaken.
All right, the doctor's in. Go ahead.
Doc, what are my jokes? Doc is funny. Good morning, Doc.
How are you doing? You guys are funny. You're the funniest. How are you guys doing?
100%,
Okay.
Doc, 100%. Doc, we've brought you in this morning. Obviously, you know, it is Breast Cancer Awareness Month, and we want to have the conversation around breast cancer and everything surrounding it.
Sure,
All right.
definitely.
So can we talk about breast cancer? What
What
exactly?
is breast cancer?
Yeah.
Okay, so when we want to define what a cancer is, we always say this is a disorderly growth of cells. Generally, you know, in your body, you have cells that are growing and some are dying at the same time. But with cancerous cells, these are cells that are continuously growing and they don't really follow the rules that are depicted within the body. So in this instance, this is a disorderly growth that is occurring within the breast. So that is what breast cancer is. Of course, there are different types of, like we call them histological types of breast cancer, but I don't think we can delve into that.
Yeah, we need
this.
lots more time
Yeah,
for that
exactly.
one. So
We
need a
really
podcast.
need a lot of time. Yeah.
Yeah.
All right, Doc. So I think we'll start at the beginning. We now know what it is. Let's get to the how regularly should we test and check, self-check? Because I think the first place is we self-check, right?
Yeah. Yeah.
And how do we do a self-check?
Okay, so the breast goes through changes within a
Yes.
month. When we say a month, we're talking about the menstrual cycle. Okay, there's a part of the month where your breast will actually feel quite heavy, and there's a part of the month where it feels not so heavy. All right. So what will then change if you're going to be examining yourself throughout the whole month is that consistency. So you won't be able to detect if there's a lump within your breast. So we always advise women to pick a day within the month or a part of the cycle where they can actually do like regular checking of the breast, like self-examination. All right. There are specific movements that need to be done. It's well, I won't be able to demonstrate, but basically what you are trying to do. Simba, are you volunteering?
I was going to check and see maybe, I know the circular motions.
I think because it's less inappropriate for social media.
Right.
I'll do a check on Simba.
Maybe I can explain something.
Okay.
Because
Your
if I
your
test,
breast-
if Simba tests me,
It'll blow
It's
up.
wrong.
We'll be trending.
Yeah,
It's
but
wrong.
you should actually do a self-check. All right,
Yeah.
we advocate that women should do a self-check, and then they can also have a practitioner do it for them. All right. So the breast is divided into 4 parts, which we call quadrants. So essentially, what you're doing with the circular motion you're talking about, you're essentially palpating or feeling in the different quadrants, and also the nipple areola area. Okay, so that's the basics. The basics.
it
of,
can be in that area. It can be in the
yes,
nipple
breast
area.
cancer can be in that area as well as into the armpit. You
Doc.
you have a part of your breast that actually grows into your armpit. So you have to put your hand into the armpit as well.
Oh, okay. Because I think we've always just felt like it's a lump. So we're like, it's a lump. Now that you said in the nipple area, I'm like, ew.
Yeah.
Okay, we learn everything. We learn new things every day.
Exactly. So what you're trying to do to detect when you are examining yourself is to look for that change, that lump that you have not been feeling before, that you are now suddenly feeling. Exactly.
Can you have a false positive? Can you, like, if you're testing yourself or examining yourself and you feel something, could it just be a normal lump there as opposed to a cancerous one?
A lump is not normal. That's for a start.
Okay.
But what we need to understand is that you can have lumps that are not necessarily cancerous.
Okay.
Okay.
But Doc, every female has a lump in there. Oh, unless it's just me.
Okay.
You need to
So
go get checked.
sometimes what happens is that you can feel some lumpiness within the breast because of that cycle and the change in your hormonal status during
Okay.
the month. Okay, so the reason why we ask women to examine themselves is not to cause alarm, but to say this is the first step for you to then seek medical assessment. So the doctor will also help in assessing your breast. They will First of all, they will examine you physically, and then they will order ultrasonography. Ultrasonography is probably very useful because now we are saying we're using some imaging modality to look for a lump and look for changes within that lump that can actually depict a cancer. For older women, that is above 40, we then recommend a mammogram because a mammogram is more specific for women that are of that age.
Yeah.
But for women that are younger than 40, it might be very difficult for a mammogram to actually show you anything.
Okay. So you've already spoken about age. Is there a particular age that women or girls should actually start going for mammograms and professional screenings?
So screening in general, historically, we used to start screening women at the age of 40 going onwards. But for some reason, we are now starting to find more and more women with breast cancer under the age of 40. So we are advocating that as soon as a woman has breasts, I think the best thing to do is to just start examining yourself. If you find a lump, the lump has to undergo a full assessment. Full assessment means you are going to do the examination, you're going to do the imaging, you're also going to do a biopsy if indicated. A biopsy now is where we take a sample of the tissue and we send it to the lab so that we are able to pick whether it's a cancer or not.
All right, Doc, you've been talking so much about women and the breast cancer. Can men get breast cancer?
Yes, men can also get breast cancer. It's quite rare. So out of 100, you have 99 women having breast cancer, but 1 man having breast cancer.
Okay.
Why is that one? What causes it? Is it something they inherit in the family?
Yeah, so remember, for women, there's a lot of hormonal
Yes,
interplay
changes.
that comes into play, causing the woman to be at a higher risk for having breast cancer. But for men, there is also the genetics of it. If you have a family history of certain cancers, not just breast cancer, like ovarian cancer as well, and prostate cancer, you can actually be at risk of having breast cancer.
Okay. Treatment. What sort of options do we have in Zimbabwe for breast cancer? Treatment options.
Wow, the world is changing, and we are also moving with the times as well. Historically, I know we would say if you detect breast cancer, we're going to remove the whole breast. But nowadays, I have a few of my friends that are very, very well educated in this and are quite good at what we call breast conserving therapy, where you can actually remove the cancer, get the patient to go through certain treatment modalities like chemotherapy and radiotherapy and still be able to preserve the breast.
Oh, nice.
Yeah, so that's something that you should ask your local doctor to explain a bit further on.
And
Okay.
how does our diet affect our chances in getting breast cancer?
So you're bringing in the question of what we call risk factors. So we have what we call modifiable risk factors and non-modifiable risk factors. Modifiable risk factors are those to do with your lifestyle. So alcohol, tobacco smoking, obesity, lack of exercise are actually noted to be risk factors for breast cancer.
Okay.
Then there's another one as well. Use of contraceptives as well is another risk factor for. The oral contraceptives is a risk factor for breast cancer. Then there is the genetic side of things. That one you're not
can't
do
fight
much
it.
much
Yeah, you
about
can't
that.
really do
Yeah.
much.
So if you have a family history of breast cancer, you probably need to be screened a bit earlier.
Okay.
Yeah.
All right, Doc.
So lifestyle changes, you say a bit more exercise in your system, better diet as well, can reduce the risk of developing breast cancer.
Yes. Did you know that breastfeeding is actually protective against breast cancer?
Oh,
Yes, it is.
Okay.
All right, Doc.
all right.
Today you're dropping nuggets.
No, it's
Well,
like
this is the month of
puppy
October,
time.
and we really need to
No,
throw in
because
that
this
information.
is the first time I'm actually hearing about oral contraceptives being something that makes people
Potentially,
high risk.
yeah.
Yes, and I'm also hearing for the first time that breastfeeding.
Yeah.
Some people are just like, oh no, I don't want to breastfeed when I have kids. So I
yeah.
think maybe that helps and it will change people's minds about it.
True story. How can families and communities support those going through breast cancer treatment? Because that's also an issue.
It's that's a very long topic. Okay, but what I can tell you is there's a lot of emotional drama that goes with any disease. So breast cancer is not an exception. So there's a lot to do with financial support as well. That needs to you need people that can help you financially, because remember you're going to have like all these tests done. You're going to need treatment like your chemotherapy, your radiotherapy. It's quite expensive.
Yeah.
Okay, so you really need the community to come in and help with that. And I think health awareness programs as well are quite helpful.
Okay. Yeah, Doc, it's
Do you know,
heavy.
I'll really be trying to do my job,
And then?
and people will be trying to get me fired from the job.
Really?
The messages that are coming on once, I can't even read them.
Okay, so what we're going to do is we'll forward
For
these
online.
messages. We'll forward these messages to Doc. Doc will respond, and we'll put
Wow.
those responses on our social media.
Oh, can I
Yeah.
put the numbers as well so people know that who was asking?
Yes, absolutely.
Okay.
Nemazita Acho. Put your name down as well. Doc, we appreciate you. Thank you for coming through for the Doctors In this morning. That's Dr. Muriva, the bump surgeon on social media. We'll be seeing you again soon, hopefully.
Definitely.
Cheers, Doc.
We